With so much confusion over how to deal with healthcare workers returning to the U.S. from the Ebola hot zone, the CDC just released some new guidelines in an effort to get everyone on the same page. But with some states already putting their own rules into place, is this too little, too late? CNN senior medical correspondent Elizabeth Cohen is live in New York City with more. Elizabeth, what's the gist of these new protocols that the CDC just minutes ago announced?
Right, Jake. So the gist is that there wouldn't be a routine quarantine. They're not recommending a routine quarantine for healthcare workers. Instead, they're saying, let's do more intensive monitoring. That was Dr. Tom Friedman's phrase from the CDC, more intensive monitoring, having daily contact with local health officials, asking the healthcare worker how they're feeling. Sounds like having sort of longer conversations about their symptoms. So, for example, with Dr. Craig Spencer, one of the issues was that he was feeling sluggish, but still went out in public, still went bowling, still went to restaurants. It sounds like now with that conversation, the health official might say, whoa, hold on a second. If you're feeling sluggish, let's not go out into public places. But again, I think the headline is no routine quarantine for returning healthcare workers. But as you said, this is not for the federal government to decide. They can make recommendations and guidelines all they want. In the end, it is up to the states to make the rules.
And Elizabeth, Dr. Craig Spencer, who you were just talking about, New York City's first Ebola case, he's the main reason why the state of New York decided to enact stricter policies for healthcare workers. Do we have any updates on his condition? Last I heard, things were getting worse for him.
Right. Things were getting worse, that he was having gastrointestinal symptoms, which he wasn't having at the beginning. He's received a plasma donation from Ebola survivor Nancy Reichel. He's taking an antiviral medication. Then there was some indication he was maybe getting a little better, a little worse. That happens with Ebola. It sometimes gets better and worse, better and worse. We haven't had a very specific update on how he's doing, if his temperature is up, if his temperature is down. Hopefully he will be, like every other U.S. Ebola patient, a survivor, except, of course, for Thomas Eric Duncan, the Liberian man who received his treatment very late in the game.
All right, and of course, the plasma donation from survivors of Ebola are given because the blood has antibodies that could maybe help the new patients. Elizabeth Cohen, thank you so much.